First, you want to identify what patients you're going to be using this on. So in your unit, it will most likely be your post-cardiac arrest patients, but also it's used for fever. So if you have a patient that has a neural fever for some reason, for any brain injury, then you can use it on the normothermia setting. But otherwise, for cardiac arrest patients, you're using this for hypothermia to prevent secondary brain injury. So the whole point of it is to prevent them from becoming a vegetable. You want them to wake up neurologically intact. So it's important that we just try to start it as quickly as possible. So I always try to tell the nurses to be the advocates in saying, do you think this patient should be cooled? Because if the doctor says no, then you have to have a good clinical conversation about why not. Otherwise, the AHA says all patients should be cooled after cardiac arrest. Obviously, if they're a DNR, they're not going to, but otherwise you have to have that clinical conversation. So know where the pads are located and where the devices are located. So the units that usually have it are BT3 and CVICU. Because the delay sometimes is just getting the equipment, right? So BT3 has pads and CVICU, I believe, has pads. You're going to get one bag of pads. They come in small, medium, and large. So small, or on here, there's a quick reference guide, and if you go to the pad sizing, it'll give you some weight-based pad sizing. So you can choose the right size for your patient. I would always err on the side of being too large because you can overlap as much as necessary. You don't want it to be too small because you want them to be covered nipples to knees. So I would just say, remember covering of nipples to knees. So when you get your pads out of the big silver bag, there's going to be 4 pads per bag. You need to have 4 pads plugged in order for it to work. You'll have 2 thigh pads and 2 torso pads. So the thigh pads are made out of foam. The channels are where the water gets primed in through the channels and then pulled back into the device, so it's on negative pressure. The little beads are to prevent any kind of heavy weight, so no matter how heavy the patient is, the beads will prevent the weight from even distribution of water throughout. The outside foam actually works like a human koozie, so you can take your patient off therapy for up to 30 minutes, and it will keep the same temperature. And they have to go on clean, dry, and intact skin, and they are radio translucent, so CT, MRI compatible. You can X-ray with water running, and it will not interfere with the X-ray. So you're going to wrap the pad circumferentially around the thigh. So you want it to be in intimate contact with the skin, so make sure that you take your time in placing the pads, overlapping as much as necessary. You'll have a lot of groin space. You want to make sure you don't have a big gap up here because then it won't be connected to the patient's skin. So just take your time in putting it on. It's not life-saving, it's not a vent, so we can like take our time in putting it on, making sure. Fluid delivery lines always go anterior toward the foot of the bed. Then you get your 2 torso pads. When you take the sticker off, because it is so sticky, just take it off as you're going, or you're going to stick it to your hair and everything else. So make sure you take the sticker backing off as you go. Roll your patient on their side. Line it up with the spine. So you want to have it squished out in the back over any bony prominence. Roll them over and overlap it in the front. So overlap as much as you need to. Or if your patient is too large, then you can get a universal pad that looks like a square, smaller and cheaper. Place it right on top. You can use up to 2 of those. There's bifurcations in the front, so tubes, lines, and drains can go in between, or you can fold it in, all 4 quadrants, sticky to sticky, or just take the backing off, use a scalpel, and cut it to here, so that this could just kind of flap over the patient. Sometimes I don't like sticking things sticky to sticky, so I say to do that. So overlap as much as necessary, or if they're too big, put on one of those. Once you have it connected to your patient, make sure that you find your machine, plug in your temperature source. So your temperature source is usually esophageal or Foley. And when you connect the pads, you want to use this as a disconnection piece, so you don't want to touch it during connection. It's universal, so it can go either direction. You just want to plug it straight in. When you hear the click, you know that you're connected. When you come to your device, you're actually going to be at your treatment screen. Once you turn it on, your programs are already in here, 33 degrees for 24 hours, and a 16-hour rewarm up to 37 degrees. So you're just going to touch your therapy. You're going to say that you're treating a new patient, an adult, and then you're going to press start. So once you press start, it's going to read your patient's information on the left-hand side. Water information is going to be on the right-hand side. You can toggle back and forth so that you can see the temperature in Fahrenheit, so it's easier to understand. And then you'll watch as the water gets primed into the pad. You want your patient to get to goal within 1 to 2 hours. If they don't get into goal within 1 to 2 hours, you want to make sure they're covered nipples to knees, or make sure they're not shivering, give medication. So that's the only 2 reasons why someone wouldn't reach goal as quickly as possible. You want them to get as cold as quickly as possible. This is showing you how the water gets primed through the pads. It's kind of cool because you can't see that in real life. And then once your patient reaches 33 degrees, this 24-hour countdown will count down for you 24 hours. After 24 hours at 33 degrees, a pop-up will appear and say, hey nurse, it's time to rewarm. And you would press start on rewarm, and then it would rewarm them slowly over 16 hours, automatically flip them over to normothermia, and stay at normothermia until you turn it off. So your protocol is 24 hours cool, 16 hours rewarm, 24 hours normothermia. So the pads are good for 5 days, and the therapy is about 5 days long. So you don't have to replace the pads unless they have a fever issue. Then you can replace the pads, keep them on normothermia forever. As long as you're doing your skin checks, there's no worry about any kind of thermal injury under the pads because you're always diligently looking at the temperature and intervening if the temperature starts to get cold. So something to remember with Artic Sun is you want the patient's water temperature to always be fluctuating above your patient's temperature. You want it to look like this all the time. So the visual is that the water is always fluctuating above the patient temperature line. If the water starts to get colder toward the patient temperature, then you want to intervene and say, why is the machine working harder to keep my patient at goal? And you're going to check the patient. So you don't have to adjust the machine. It's going to take your patient's temperature every single second, and it's going to change the water temperature every 2 minutes. So you just have to give it a little bit of time. On your freeze screen, no little hands can mess with it. It tells you everything you need to know, your cooling, your patient temperature, your water temperature, and then right here is usually a dial that looks like a speedometer or a gas gauge, and it's blue and orange. If it's in the blue, the machine is working as it should. If it gets into the orange, it's just telling you it's working harder. So it's another visual for you to check your patient.
Because I think the Foley ones always like stop working after a certain amount of time.
Really?
Yeah.
I don't
caught it because they don't really give us an accurate time.
I don't know why that would be. The Foleys are made by the same company, and they are supposed to work on ambient body temperature, so whether there is or isn't fluid in the bladder. And their second most accurate. The most accurate is esophageal. You have two temperature sources in the back in case you want to use a second temperature source, like measuring esophageal and Foley. Whatever you have plugged into number one is going to display on the screen. So if you have the opportunity to do esophageal, I would always do esophageal. I don't know about, I've not heard that ever about Foley.
Rectal probe work with it?
Yeah, and rectal and esophageal are the same, it's just no matter where you put it. So they all are compatible with this plug. And then the only other thing to think about is when you're going to take your patient to an exam, you want to hit stop. When you press stop, it's going to automatically prompt you to empty the pads. So you're going to press start, and then it's going to suck the water out of the pads back into the device so that it's a closed loop system. There's an algicide in the water so that it doesn't become, it doesn't get germs inside. And then you know that it's safe to unplug this from your patient. So you don't want to disconnect this until the water's been sucked back in, because otherwise the water's going to pour out of the pads onto the floor. And if that happens, I'll show you after it empties. I'll show you how to refill it. After it sufficiently empties all of the pads, this pop-up will disappear so that you know that it's safe to unplug. I also say to look in here, because if you look in here, you can really see if there's air or water movement through there. It'll just give you that second visual, since this is really going to be against your patient and you can't see. Or if you walk away and you're like, oh crap, did it empty or not? So I like to look in here and see that there's water, air, not water. When the pop-up disappears, you know it's safe to disconnect. Sometimes